as a co-owner of the company, I mean, we were kind of in trouble in the sense that we were having to hire more radiologists to come in to read mammography for us because of the data sets, the huge data sets that we had. So I was very interested in kind of looking at what, the reader study that ICAT had done to reading times. And I thought that seems kind of unfathomable, but if it actually worked, that would be a good thing for me. So we put it in really on a trial basis, and we realized right away that it did improve reading times because radiologists, I don't know, there's something about having like a second reader in the room with you that just allows you to feel much more comfortable with your interpretation on the fly. So oftentimes I think as clinicians or radiologists, we sit and we look at images and we think to ourselves, should I call the woman back or not? And is it real, or is it something that just is not, is it really just a phantom lesion that maybe isn't real? So with AI there, reading concurrently with you and interpreting with you, you actually have kind of a second read right on the fly. So I think you're able to make those decisions much quicker and kind of feel more confidence and move through the data sets much quicker. So we did see almost immediately improvement in reading times and improvement in our radiologist capability of getting through the stack, so to say, each day. And that was really important to us. And then on the other side, we really felt like, even though, your catch rate in mammography is, as good as it gets for mammograms, but that rate isn't as high as we would get with screening breast MRI or some other technology. But when we look at it, we want to do the best job we can at finding cancers. And that ROI is really on the patient side, that I can find her cancer perhaps 1 year earlier makes a huge difference in what the community and what that patient is going to spend in their lifetime trying to fight that cancer. So that had really boosted us too when we found those earlier cancers, and we felt really good about that. I think, as Dr. Sorensen said, we felt like we were all getting to be better radiologists because of it. That's really a good plus, and that helps in the I guess I would put more of a soft touch on that. That helps in the feelings of radiologists about themselves, because oftentimes we get lost in the fact that we're just working in a black box by ourselves, reading, 28,000 images a day or looking at 28,000 images a day, and you're like, what is happening? Am I really helping anyone? And did I miss, something? And you go to bed at night, you can't sleep. So you can't measure the ROI in dollars about what it does for the mental health of radiologists to sit in a room with someone else there with them. And I think that's important.